Okay, before we begin the assessment, can you please verify that you are over the age of 18 and you give consent to be filmed?
My name is Travis. I'm over the age of 18. I give consent to be filmed.
Okay, thank you. Let's begin. Knock, knock, knock. Hi, I'm Belle. I'm going to be your nurse today. I'm going to go ahead and give us patient privacy. Do I have permission to have my instructor in the room with us?
Yes.
Okay, I'm going to go ahead and perform hand hygiene. Can you please tell me your name and your date of birth?
Eleanor White,
Okay, and your date of birth?
April 18th, 1944.
Okay, thank you so much. Today I'm going to assess your heart and lungs. Both exams require me to touch you to palpate your pulses and listen to your heart and lung sounds. Do I have your permission?
Yes.
Okay. And what sex were you assigned at birth?
Female, sweetie.
And what gender do you identify with?
Female.
Okay. And what are your pronouns?
She. She and her.
Okay. And what are we seeing you for today?
Chest pain.
Okay, great. Do you have any other problems or diagnoses that we should know about?
Coronary artery disease.
Anything else?
Diabetes.
Okay. And do you have any allergies? And if so, what is your reaction?
No.
Okay. So no allergies and no reaction. Perfect. Are you experiencing any chest pain or discomfort today?
Yes.
Okay. Are you experiencing any dyspnea, which is shortness of breath?
Yes.
Okay. Are you experiencing any orthopnea?
Yes.
Okay. Are you experiencing any cough?
No.
Okay. Are you experiencing any sputum production?
No.
Okay. Are you experiencing any chest wheezing or tightness?
Yes.
Okay. Are you experiencing any changes in your functional ability?
No.
Okay. Now I'm going to assess your breathing. So just go ahead and breathe normally for me. Okay. And your breathing is unlabored. And it appears symmetrical. Now I'm going to inspect the chest. So if you don't mind, if I can just lift up your shirt, please. Okay. Okay, so everything looks symmetrical. Your chest rise and fall is even. So now I will be, or I also already palpated the chest and I did not feel any abnormalities, so no abnormalities noted. Now I'm going to test for tactile thermitis. So if you can please sit up for me. Okay. Are you able to turn for me a little bit? Maybe scoot some way. I'm going to be lifting up the shirt and testing your back.
Feel free.
Okay.
Feel free, sweetheart.
Okay.
Okay.
Okay. So when you feel my hands touch your back, can you please say the phrase 99?
99. 99. 99. 99.
Okay. Thank you for that.
99 is fine.
Okay, you can go ahead and sit back for now. Okay. So, there is no tactile thermitis indicated. And I'm now going to auscultate the anterior and posterior thorax. And I'm sorry, but I will actually need you to sit up for me one more time, if you can.
Sweet.
Okay. Are you able to lift up your shirt for me or possibly take it off?
The shirt or just this?
You can, if you're comfortable, I can lift your shirt up. That's fine.
Go ahead.
So you can just go ahead and breathe normally for me.
So.
Okay. Now I'm going to do it posterior, so on your back. So if I can. Are you able to turn for me that way, Miss Eleanor?
Yeah, sweetie.
Can you turn for me facing that way, please?
The wall?
Yes, please. Okay. Then go ahead and just breathe normally for me.
99.
No, just please breathe normally for me. Okay, thank you for that. You can just stay there for me, that would be great. Okay, and after auscultating, you have normal breath sounds, which is great. So now I'm going to assess for bronchophony. So now, once I put my stethoscope on you, once you feel the touch, if you can please say 99 every time you feel me touch. And you can start posterior. So if you can turn for me. And again, every time you feel the touch, please say the phrase 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay, now I'm going to do it anteriorly, please. And same thing, once you hear or once you feel me touch you, please say the phrase 99.
99. 99. 99. 99.
Okay. Now, thank you for that. There is no consolidation. Everything sounds normal to me. Are you experiencing any chest pain?
Yes.
Okay, and are you experiencing any dyspnea or difficulty breathing?
Yes.
Okay. Are you experiencing diaphoresis or abnormal sweating?
No.
Okay. Are you experiencing any fatigue?
Yeah.
Okay. Are you experiencing any edema or swelling in your arms or legs?
Yeah.
Okay. Are you experiencing any nocturia? This just means you're getting up in the middle of the night to urinate.
No.
Okay. Are you experiencing any heart palpitations or fluttering in your chest?
No.
Okay. I'm now going to inspect for JVD. So I'm inspecting, and there is no jugular venous distension bilaterally. I'm now going to palpate your carotid arteries, and I am going to do this one at a time so that you do not pass out. So if you can just sit normally for me. Okay, is there a problem?
No, we're good. Let's go.
Okay.
Let's go. I thought you were pass out.
Okay, perfect. Thank you for that. Your carotid arteries are equal bilaterally. I'm now going to auscultate your carotid arteries. So if you can just sit and relax for me again.
Okay.
That's fine. And you can just go ahead and breathe normally for me. Okay. Okay, thank you for that. And there is no carotid bruit present bilaterally. Now I'm going to auscultate the cardiac valves. So if you can go ahead and lay back for me.
That one?
Yep, can you please go ahead and lay back for me?
Do you want me to lay down?
If you're comfortable there, that's fine.
Okay.
Sorry, give me 1 second. Okay. So first, I'm going to find the aortic valve, which is located on the second intercostal right clavicular line. Okay. Next, I'm going to auscultate the pulmonic valve, which is located on the second intercostal space left to the clavicular line. Okay, next I'm going to be locating Erb's point, which is located third intercostal space left to the clavicular line. Okay, now I'm going to be locating Erb's point, which is located third intercostal space left clavicular line. Okay, finally I'm finding the mitral or apical valve, which is located in the fifth intercostal space mid-clavicular line. Okay. And I heard S1 and S2 in all valves. So that is great. And now I'm going to palpate the PMI, or the point of maximal impulse. Okay, so when I place my hands on you. Please exhale and then hold your breath. Okay.
Exhale and do it.
Just hold your breath, please. Or exhale and do it. I'm sorry about that. Okay. Thank you for that. I don't feel any heaves. There's a regular heart and rhythm. Are you experiencing any pain in your arms or legs?
No.
Any numbness or tingling?
No.
Any cramping in your arms or legs?
No.
Any skin changes?
Nope.
No evidence of cyanosis present?
No.
Any decrease in your functional ability, meaning you are able to move your arms and legs okay?
No.
Okay, now I'm going to inspect and palpate your arms and legs for lesions. So if you can please lay back for me again.
Oh.
Sure, that's fine. If you want to lay that way, that would be much helpful. Okay. And your skin is warm, the temperature, and your muscles are symmetrical bilaterally. There also doesn't appear to be any changes in color. Now I'm going to palpate the brachial pulse. And the brachial pulse is located in the bicep tendon. And I will do that now. Okay. And I'm going to do this arm as well. Just relax. Okay. And they are equal bilaterally, which is great. Now I'm going to palpate. I'm actually going to redo your brachial pulse to just ensure that they are the same. That's okay.
It's fine, sweetheart.
Okay, and they're equal. Now I'm going to go ahead and do your radial pulse. Okay, and those are also equal bilaterally. Now I'm going to assess the popliteal pulse. So if you can just slightly bend your knees for me.
Oh.
Yes, just slightly. Okay, and those are normal bilaterally. Now I am going to assess the posterior tibial pulse. Move your foot up a little. Okay. And those are also equal bilaterally. Now I'm going to find the dorsalis pedis pulse. Okay. And those are also equal bilaterally. Now I'm going to inspect your nails. Now I'll be inspecting all of them. Okay, and I'll be checking your fingernails as well. Okay, thank you. They are short in length, pink with no clubbing or cyanosis. Now I'm going to be assessing capillary refill on the fingers. So if I can please have your fingers. Okay. Okay. You can please relax your thumb for me. Okay, thank you for that. All 10 fingers, the capillary refill is less than 3 seconds bilaterally. Now I'm going to be assessing the capillary refills on the toes. Okay. And the capillary refill is less than 3 seconds bilaterally. I'm now going to assess your skin turgor. We can start with the feet. I'm also going to check in your hands, please. Okay. Now there is no tenting present, which is great. And I'm now going to perform the sorry, give me 1 second. Okay. And we will do the we're just going to go ahead and move along. So this is actually going to conclude my assessment, Miss White. Do you need anything before I leave?
No.
Okay, well, here is your call light, and please don't hesitate to push it if you need help. I'm going to go ahead and perform hand hygiene and once again provide patient privacy.